Hello, and welcome to your first course in the RN to BSN program. I'm Dr. Armin Davis, and I will be your facilitator together we will explore the dimensions and perspectives of the different roles of a BSN. Our exploration begins by discussing nursing historical background, followed by the defining new buzzword of evidence-based practice. We will then discuss the importance of nursing theories, and ending this session looking at the essentials from AACN. The primary objective of this program is to prepare you to become a nurse generalist with a Bachelor's of Science in Nursing. That is, you'll be prepared to perform wherever your life journey takes you. So let's begin. There are several historical events responsible for nursing practice, including the development of nursing, theory, nursing education, and nursing research. As Santillan in 1953 stated, those who cannot remember the past are condemned to repeat it. And according to Blaze in 2011, she stated that knowing the past and understanding the roles of early nursing leaders provides an opportunity to use the experience and lessons learned to create our future. Historically, it shows that life and death was simply a phenomena. The focus was simply on survival, and the environment played a key factor in two ways. One, it was responsible for most of the illnesses then, as well as the cures, as herbal was their primary treatments. Gender, people were nursed by both. The term nurse, then, is nutricus, derived from an English word meaning nutris or to nourish, which we use today. As life and environment evolved, so did some of the other concerns. Children, elderly, and the sick had to be cared for, and it was done mostly by women, slaves, or midwives. Disease was a mystery, and magical cures were used. Therefore, the priest or medicine men became the primary healers. The Egyptians were the first to keep medical records, classify drugs, and develop a system to maintain cleanliness. Their system, by the way, is still is in practice today by many of the Jewish and the Muslim faith. The Babylonians, then, were the first to maintain records and develop the Code of the Hammurabi. The code for sanitation, public health, and surgical procedures are mentioned. They made a distinction between human and veterinary medicine, and they had a fee code for surgery. They also had a violators code. There's no mention of nursing as we know it today. However, the task that a nurse performed is discussed. Globally, the Parisians, the Chinese, the Italians, and the East Indians were also recording their medical codes. Romans developed the medical guideline for practice and issued penalties for malpractice. During the 500 AD and 1400 AD, there were mention of men in nursing. These men belonged to a knighthood order who combined religion, chivalry, as well as charity, therefore carrying soldiers from the battlefield to the hospital. And in 1974, here in America, there was an American Assembly of Men. Back to the 1500s, we noticed that there was an old medical text, the oldest medical text, called the Ebers Papyrus, where mummification and embalming is mentioned. Pretty knowledgeable group of people back then. Knowledge of human anatomy and physiology and pathophysiology is mentioned. The Hebrews developed the Mosaic Healthcare Code. They talked about family, individuals, and community. They talked about sanitary requirements and defined the difference between clean and unclean. They also mentioned the importance of rest and sleep, which is something we don't get much of here in this country. They talked about rules for women's menstruation and childbearing, as well as dietary laws such as koshers are mentioned. They also wanted to keep communicable diseases at bay, so they quarantined if there was leprosy or diphtheria. And as far back as the Old Testament in Genesis, you see in chapters 24, verses 59, that nurses are mentioned as midwives. However, they're wet nurses. They were female slaves. Other parts of the world, in ancient Africa, you hear midwives mentioned, herbs mentioned as their meds, and caregivers for children and elderly. In India, you see that male nurses are mentioned, and they're knowledgeable of calculations of meds, and they were very clever, and they were devoted to the patients as well as purity of mind. In China, although no mention of nursing, there were 365 herbal remedies, as well as their tool acupuncture. And the famous saying of look, listen, and feel is definitely referred to. During 500 to 1500 AD, Christianity blossomed. The message, one should maintain their health as well as maintain the health of others, is definitely the focus. Hospice was established during this period of time for palliative care, and the term hospice to hospitals was derived. During the 460 to 350 BC, the Greek physician Hippocrates is mentioned, who's our father of medicine. He wanted to know that he stated that there's a natural cause for disease, and the Hippocratic Oath was developed. In Rome, during 200 BC, it's mentioned that they borrowed the physicians from Greece, used them as slaves, and they provided the medical care to the Roman population. The Romans gave us public sanitation, private bathing, and central heating. During this period of time, Christianity played a major role. They stated that love thy neighbor as thyself, and it helped to develop nursing as we know it today. Women as well as men provided nursing care. In 3 AD, organizations of men called the Parabolani Brotherhood, Knights of Hospitallers, Teutonic Knights, and Knights of Lazarus provided care to the sick and injured comrades. Result, hospitals were built, setting standards throughout Europe. Christianity grew and hospitals grew. Care for orphans, widows, elderly, and the poor and the sick took place. However, although the churches did a good thing by advancing this and caring for this population, they did not allow for the advancement of science or education. Thus, knowledge and disease went lacking. The Muslim women prepared food in tent hospitals for the sick, had tent hospitals and attended to the sick. They opened nursing schools. And in France, in 1633, the Sisters of Charity was founded, St. Vincent de Paul, which you still might hear of here today in the America. In 1836, there was orders of diocese who had opened the Kensingworth Institution in Germany. During 1500 to 1700 was the period of the Renaissance. Medicine developed in areas of science and technology, and the Elizabethan Poor Law became in effect. That is, hospitals became a place for people to die because they cared for the poor, the blind, the orphaned, and the lame. Therefore, negative connotations ensued because the rich were cared for at home by nurses, mainly women, and they provided funds to the poor, which is a good thing. In 1600 AD, the Roman Catholics founded the Sisters of Charity in France. Between the 18th and 19th centuries, intellectual revolution began. There was new continents being discovered. The economic system began to really explode, which was like that today. And you heard about Florence Nightingale due to the Crimean War. And then the Industrial Revolution followed, which gave us technology throughout the world, factories, mass production, metropolitan cities. There was overcrowded cities and housing, poor hygiene, poor health, poor working conditions, and the emergence of the plague. The germ theory also emerged, and in the late 18th century,